This conference is being recorded. Cette conférence est enregistrée.
Bonjour et bienvenue à cette press conference. Je vais maintenant passer la parole au ministre Leblanc pour débuter. I will now turn to Minister Leblanc to begin.
Alors, merci beaucoup.
Thank you very much, Jean-Sébastien. Good afternoon, everyone.
Today, I'm joined by my colleague, Minister Anita Anand, Doctors Tam and New, and Brigadier General Brody. Je voudrais maintenant inviter
I'd like to invite my colleague, Minister Anand, to take the floor. Anita.
Thank you so much, Dominic, and it's just great to be here with everyone today. I'm going to provide you with a brief update on where we stand regarding the procurement and delivery of COVID-19 vaccines. From the beginning, our government has said that all eligible Canadians will be able to be fully vaccinated by the end of September. Thanks to the groundwork that we laid by signing agreements with a variety of leading manufacturers, we are not only meeting but also exceeding our initial targets. Nous avions dit que nous allions recevoir.
We had said we would receive 6 million doses in the first quarter of this year, and we received 9.5 million. We had also projected between 48 and 50 million doses by the end of the second quarter. And we are actually on track to beat the top end of that range by hundreds of thousands of doses.
We had projected that we would receive 6 million doses, and because of our aggressive negotiations, we accelerated this number and ultimately received 9.5 million doses of COVID-19 vaccines. We had projected between 48 and 50 million doses to arrive by the end of the second quarter, being the end of June, and we are on track to beat the top end of that range by hundreds of thousands of doses. We have delivered 44 million doses to the provinces and territories. As of yesterday, they have administered more than 36 million doses. And according to the latest numbers, 77% of eligible Canadians have received at least one dose of vaccine. À l'heure actuelle, le Canada demeure.
As it stands, Canada remains first in the G7 and the G20 for the number of first doses administered. And more Canadians are getting their second dose every single day. By the end of July, I can confirm that we remain on track to have received approximately 68 million doses.
Canada remains first in the G7 and the G20 for the number of first doses administered. And more Canadians are getting their second dose every single day, including, I may add, myself. This morning, I am happy to report that I received my second dose from the vigilant healthcare workers staffing the Halton Regional Vaccination Clinic at the Oakville YMCA. Thank you so much. By the end of July, I can confirm that we remain on track to have received approximately 68 million doses of COVID-19 vaccines. All of this is a result of the Team Canada effort, which we have witnessed from the very beginning of this pandemic. While the end is in sight, we are not there yet, and we must remain vigilant. Vaccine supply chain disruptions, unfortunately, still occur. Case counts are following, but we still need to keep our guard up to ensure that vaccines continue to arrive in Canada. This is the work that my department and I will continue to do every single day, accelerating deliveries and ensuring arrivals of vaccines for Canadians. So let us all continue to exercise caution and follow public health guidance And if you haven't yet and you are eligible, please get your shot and do your part to conquer COVID. Les vaccins sont ici. Et nous
The vaccines are here. More are on their way. And if we keep up the fight, we will get through this together.
vaccines are here. More and more are on their way. And if we keep up the fight, we will get through this together. Thank you. Megwetch. Merci beaucoup.
Thanks very much, Anita. And we'll now turn to Doctors Tam and then Dr. New. Dr. Tam.
Merci. Bonjour à tous. Nationally, 7-day rolling averages continue to decline. Our current national case count is down to less than 640 new cases reported daily. On average, 988 people with COVID-19 are being treated in our hospitals each day, including 486 in intensive care units, and an average of 14 deaths are being reported daily. But the big news is what's continuing to go up. And this past Sunday, the city of Toronto rose to the top when, at a single vaccination clinic, Torontonians stepped up to break through the Canadian one-day record and fly past the North American record to score a worldwide record of almost 27,000 doses given during a day dubbed #Vaccine Day. People all across the country can take pride in this record because so many have stepped up to get vaccinated and encourage others. This is a winning shot for everyone. And though we still need to get more sleeves up for the first and second doses, keep up with precautions as immunity builds across our communities, and listen up to public health advice for awareness of local COVID-19 risks. More and more of us are asking, when can we hug our loved ones? In particular, grandparents, aunts, and uncles are looking for advice for when they can share hugs with the kids in their lives. The answer is, because children under 12 are not eligible for vaccinations yet, there is still a risk they can get infected with COVID-19 and pass the virus on to others. However, if you and everyone else around them are fully vaccinated, the risk is lower. By assessing everyone's risk and comfort levels, you can determine if additional personal preventive practices are needed when hugging or being close in person, such as wearing masks and gathering outdoors. During this time of transition, many people may feel more comfortable continuing with individual precautions such as mask wearing and physical distancing. Let's continue to support each other by respecting each other's personal risk comfort levels. As well, we should all remember that simple things like frequent hand washing and staying home when we have symptoms also reduce risk of many infectious diseases and continue to be important. So let's keep working it up together to get Canadians protected and vaxxed to the max. Thank you. Merci. Magwitch.
Bonjour à toutes et à tous.
Good day, everyone. Nationally, 7-day rolling averages continue to decline. Our current national case count is down to less than 640 new cases reported daily. On average, 988 people with COVID-19 are being treated in our hospitals each day, including 486 in intensive care units, and an average of 14 deaths are being reported daily. But the big news is what is continuing to go up. And this past Sunday, the City of Toronto rose to the top when at a single vaccination clinic, Torontonians stepped up to break the Canadian one-day record and fly past the North American record to score a worldwide record with almost 27,000 doses given during a day dubbed #Vaccine Day. People all across the country can take pride in this record because so many stepped up to get vaccinated and encouraged others. This is a winning shot for everyone. And though we still need to get more sleeves up for first and second doses, keep up with precautions as immunity builds across our communities, and listen up to public health advice for awareness of local COVID-19 risks, more and more of us are asking, when can we hug our loved ones again? In particular, grandparents, aunts, and uncles are looking for advice for when they can share hugs with the kids in their lives. The answer is because children under 12 are not eligible for vaccination yet, there is still a risk they can get infected with COVID-19 and pass the virus on to others. However, if you and everyone else around them are fully vaccinated, the risk is lower. By assessing everyone's risk and tolerance and comfort level, you can determine if additional personal preventive practices are needed when hugging or being close in person, such as wearing masks and gathering outdoors. During this time of transition, many people may feel more comfortable continuing with individual precautions, such as mask wearing and physical distancing. Let's continue to support each other by respecting each other's personal risk comfort levels. As well, we should all remember that simple things like frequent hand washing and staying home when we have symptoms also reduce risk of many infectious diseases and continue to be important. So let's keep working together to get Canadians protected and vaxxed to the max. Thank you. Merci, Miigwech.
Thank you very much, Dr. New and Dr. Tam. We'll now turn to Brigadier General Brody.
Over the past 7 months, we have delivered nearly 45 million COVID-19 vaccines across the nation, first in smaller numbers and now in substantial volumes on a weekly basis. By the end of this week, we will have brought in 50 million doses to immunize Canadians. This includes provincial allocations currently managed in central inventory by the Public Health Agency of Canada, ready to be called forward to support vaccination strategies at the time and place of provinces' choosing. This inventory management approach allows us to minimize wastage while ensuring that we can continue to vaccinate as many people in Canada as quickly as possible with both first and second doses. This week's distribution of 2.4 million doses of Pfizer-BioNTech is well underway, with close to 2 million of those doses already delivered to vaccine delivery sites across the provinces. Moderna deliveries, carrying over from last week's allocations, are also ongoing. This week's allocation of 1.4 million doses arrived today for delivery late this week and into next week. Moving forward, we are still tracking allocations of Pfizer-BioNTech in July, totaling 9.1 million doses, and we are working with Moderna to confirm upcoming delivery schedules for the balance of July's allocation. We are not done yet. We are carefully monitoring upcoming supply to ensure that Canadians have the doses required to maximize vaccination rates across all eligible populations. D'abord, en plus petit nombre et maintenant en quantité importante chaque semaine.
Over the past 7 months, we have delivered nearly 45 million COVID-19 vaccines across the nation, first in smaller numbers, and now in substantial volumes on a weekly basis. By the end of this week, we will have brought in 50 million doses to immunize people in Canada. This includes provincial allocations that are currently managed in central inventory by the Public Health Agency of Canada, ready to be called forward to support vaccination strategies at the time and place of provinces' choosing. This inventory management approach allows us to minimize wastage while ensuring that we can continue to vaccinate as many people in Canada as quickly as possible with both first and second doses. This week's distribution of 2.4 million doses of Pfizer-BioNTech is well underway, with close to 2 million of those doses already delivered to vaccine delivery sites across the provinces. Moderna deliveries, carrying over from last week's allocations, are also ongoing. This week's allocation of 1.4 million doses arrived today for delivery late this week, as well as into next week. Moving forward, we are still tracking allocations of Pfizer-BioNTech in July, totaling 9.1 million doses, and we are working with Moderna to confirm upcoming delivery schedules for the balance of July's allocation. We are not done yet. We are carefully monitoring upcoming supply to ensure that Canadians have the doses required to maximize vaccination rates across all eligible populations. Thank you.
Thank you very much, General Brody. So, Jean-Sébastien, à vous maintenant. Ça nous fera plaisir, évidemment.
Jean-Sébastien will be happy to answer any questions.
Merci beaucoup, Monsieur le ministre.
Thank you very much, Minister.
Donc, tel que mentionné, nous allons maintenant débuter la période de questions. Ministers, doctors, and the Brigadier General will now be happy to take your questions. As usual, it will be one question and one follow-up. Comme d'habitude, ça va être une question et un suivi par journaliste. And I will now pass it over to the operator for the first question. Je vais maintenant passer la parole à l'opérateur pour la première question.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. The first question is from, la première question est de Mia Rapson, The Canadian Press. Please go ahead. À vous la parole.
Yeah, good morning. Dr. Tam, my first question is for you about mask wearing. I'm just curious, I think you had said that when about 75% of Canadians were fully vaccinated, that's when we could start to think about relaxing things like masks and physical distancing. But we've seen more recently calls in England and in Israel, I'm thinking specifically, to continue masks or bringing back mask mandates because of sort of a resurgence in cases. What do you think the Delta variant means for mask wearing, and how long do you think Canadians could expect to need masks or be suggested to wear masks?
Yes, thank you for that question. And of course, we're learning about variants and viruses every day, and certainly the experience in other countries do help inform us. Last Friday, I also showed some new modeling that included, amongst other things, the parameters of the Delta variant in terms of transmissibility and potential for increased impact on hospitalizations. And there we suggest that we could prevent the fourth wave if we can get the vaccine coverage even higher, and including 80% vaccine coverage in the younger adult populations to try and reduce the transmission. So I think it's a combination of things in terms of about mask wearing. And I think we do have to be quite cautious because the provinces are just beginning to open up, and we will then see what happens. Even though we have a good first dose coverage, we still need to, I think, go a bit higher. And quite a number of people haven't had the full vaccination. So this is a period, I think, that we should be more cautious. Having said that, I think that has reduced, you've seen the combination of public health measures and the vaccines reducing the impact in our communities. As things ease up, we just have to watch very carefully on what transmission looks like. At the same time, people wanted some guidance as a rule of thumb, if you like, a framework to work with for individuals who've been fully vaccinated. And we provide some of that on Friday. But still, I think in terms of being precautionary, still think about those fundamental principles of reducing your risk and where risk could be higher. For example, the 3 C's we keep talking about, things, close contact, confined, crowded spaces. Try to reduce all of those things still. We're still not quite there with vaccination coverage, and this is a period of prudence, but I hope the guidance provides some measure of yardstick for people to look at their individual situation. And I keep saying that, life after vaccination guidance is not the same for everyone everywhere. And it's not the same in Manitoba or the Yukon right now compared to maybe in the Atlantic provinces. So you do have to still follow local public health advice.
Okay, thanks. I'm sort of more talking about whether mask mandates were needed, but my second question is for Brigadier General Brody. You mentioned an inventory management approach to vaccines. I'm wondering if you could provide a little bit more information about what that means, if you're holding back significant portions of all vaccines. I know last week you'd mentioned AstraZeneca being held in back sort of for distribution as provinces requested them. Just looking for a bit more explanation of what that inventory management approach is and how many doses Ottawa is keeping aside.
At this point, we're not holding doses on behalf of the provinces as part of a federal allocation. What we're doing is assisting the provinces in managing their inventory based on their per capita allocations as confirmed shipments come in. And as over the last several weeks, as we have brought more and more significant volumes of vaccine in, we have partnered with the provinces in some cases to help manage their inventory by giving them the option of drawing their allocations down in full or in part as they move through the weeks and support their individual campaigns and programs. We have brought in 795,000 doses of AstraZeneca in the last couple of weeks. Some of those doses were allocated for the provinces based on requirements that they had identified, and a small portion is being held within our federal inventory to offset any requirements as they evolve. So certainly the situation is evolving on a day-to-day basis. We continue to bring in vaccines to ensure that we have the sufficient quantity and types of vaccines that Canadians need in order to continue our vaccination campaigns. With confirmed deliveries alone, we expect that by the end of July, we will have sufficient vaccine supply to vaccinate upwards of 90% of the eligible population, and that is tremendously good news. And as we track closer and closer to those optimal levels of doses, we'll further refine our inventory management approach to ensure that Canadians have all the doses that they require now and going into the future, and that we're well postured for next steps. Thank you.
Thank you, Brigadier General. Opératrice, à vous pour la prochaine question.
Operator.
Question.
Thank you. Merci. The next question is from, la prochaine question est de David Schickman, le CBC News. Please go ahead. À vous la parole.
Hi, yes. Hello, everyone. We have a story up about the Johnson & Johnson vaccine on CBC.ca. Basically, we don't know when we're getting any new shipments. So I guess this question is for Dr. Tam and potentially for Minister Anand. What concern do you have about not receiving any of this one-shot dose? I know we're receiving lots of other vaccines, but this vaccine, the J&J vaccine in particular, was counted on as being, this great help to vulnerable populations here in Canada who might not come back for their second dose. So yeah, what concern do you have about not receiving, any update on when we're going to be getting these doses?
I'll start. Thank you so much for the question. So last summer, we put in place a diverse portfolio of vaccines with leading vaccine manufacturers on the advice of the Vaccine Task Force and the Public Health Agency of Canada, and J&J was one of those companies. We signed an agreement with J&J for 10 million doses of the single-shot vaccine. And that contract remains in place and will be able to lead to additional deliveries of the J&J vaccine to Canada should the provinces and territories need or require that vaccine. At the current time, there are discussions ongoing with the provinces and territories regarding their desire to receive the vaccine. In other words, there is an assessment of demand that is occurring, and there's a conversation between the federal government and the provinces and territories on that point. So decisions are still being made regarding the J&J vaccine deliveries, but by all means, that contract is still in place and still able to yield vaccines for Canadians if the demand is there. I will just add that the numbers of vaccines and vaccinations in this country at the current time are high. 44 million doses of vaccine have been delivered, 36 million doses have been administered, 77% of eligible Canadians have had at least one dose, and over 30% of Canadians are fully vaccinated. We're first in the G20 for the share of the population with one dose. This is on the basis of 2 mRNA vaccines, Pfizer and Moderna. To be clear, we have procured 51 million doses of Pfizer, 44 million doses of Moderna, as well as AstraZeneca. But as I said at the beginning of my response, the J&J contract remains in place, and if the demand is there for that vaccine, we will be able to supply the provinces and territories with it. I'll turn it over to Major Brigadier General Brody to supplement my answer in case she has anything on the terms of the negotiations with the provinces and territories. Thank you.
Thank you, Minister. At this point in time, we are not receiving a strong demand signal at all from the provinces, so we continue to leave those communication channels open. If we do receive a signal from the provinces indicating demand, then we certainly have the mechanisms, as Minister Anand indicated, to bring that vaccine in. At this point in time, we are focused on the mRNA vaccines, which are those that are really in demand by the provinces in order to accelerate those second dose strategies and to really get as many first doses as we can as soon as possible. So at this point in time, the demand is really focused on the mRNA vaccines. Thank you, Minister.
Follow up, David?
Yes. So this is a totally different question, and it's for Minister LeBlanc. So, Minister, the LGBTQ plus community, we're counting on the government to pass the conversion therapy bill. The Senate rises today. People are worried the legislation won't make it through the upper chamber. So I guess the question to you is, what does this say about how seriously the Liberals are taking this issue? Are you worried the legislation won't pass? Why have we gotten to this, 12-hour situation where this really important legislation that's really important to the LGBTQ plus community might not get passed? It's in limbo, essentially.
So first of all, we certainly understand the importance of this legislation. Liberals and the government introduced this bill precisely because we recognize the importance and accept the importance that the LGBTQ community has shown for this legislative action as well. I would have you note that 62 Conservative members of Parliament in the House of Commons voted against the legislation. We believe that the Senate should study this legislation and should adopt this legislation. we're calling on the Senate to do what is necessary to bring this legislation to royal assent. We've also taken note of a number of Conservative senators who have resisted supporting this type of legislative amendment in the past. And we certainly hope the Conservatives in the Senate aren't going to frustrate the clear will of the majority of elected representatives in the House of Commons, and certainly the Liberal government, to pass this legislation. So I'll continue to work with my colleagues, the Minister of Justice and our representative in the Senate, to impress upon the Senate the importance of bringing this legislation to royal assent. So we understand the concerns of the LGBTQ community. We are of the same view that they are, and we regret that so many Conservatives oppose this legislation, but we're certainly not going to give up until it receives royal assent.
Thank you, Minister. Operator, next question. Opératrice, prochaine question.
Thank you. Merci. The next question is from La prochaine question est de Catherine Lévesque, La Presse canadienne. Please go ahead. À vous la parole.
Oui, bonjour à vous tous.
Yes, good day, everyone. Mr. Leblanc actually had almost the same question for you. But with this angle, how do you expect the Senate to pass 4 significant bills in a few hours only when these bills were passed at the 11th hour, actually, in the House of Commons last week? Answer. Look, we recognize the Senate's obligation to do its work. Nevertheless, the fact that these bills were passed at the 11th hour is in large part because of the Conservatives' filibustering tactics at the House of Commons, in the House of Commons. For weeks now, the Conservatives in the House of Commons have used a host of procedural maneuvers to prevent the House of Commons from making these decisions, voting on these bills. So it's in very large part the Conservatives' fault that we had to arrive at this stage where we're at the very last minute holding extended sessions with, in some cases, the support of the Bloc and the NDP. This is the only way we've ultimately managed to bring these bills forward, like this conversion therapy bill, or the amendments, Bill C-10, supported by cultural and artistic communities throughout Quebec and all of Canada. We needed allies in the House of Commons. That's what we did. And we hope that the Senate will really take its responsibilities here, and we think these are important bills. They represent the will of duly elected representatives in the House of Commons. We will continue to work with the Senate so that these bills can come to royal assent.
Merci. Je voulais aussi vous en...
I wanted to hear about the announcement made by Aaron O'Toole today. He is saying that if his party is elected in the next elections, the Conservatives will have a COVID emergency plan in place for COVID, but for all other types of pandemics. They intend to create pharmaceutical cooperative systems, want to strengthen the North American chain of distribution. They also want to strengthen the government's response to the pandemic. Would you have an answer to that, Mr. Leblanc or Madame Land? Unfortunately, the interpreter regrets some of that was inaudible. Answer. I may start, and then Anita could perhaps add if she would like. We are pleased that Mr. O'Toole is arriving at the same conclusions as our government. We have recognized from the start of the pandemic that Canada has found itself in a difficult situation due to the fact that over several decades, the biomanufacturing capacity in Canada has been greatly diminished. My colleague, Minister François-Philippe Champagne, Minister Baines before him, and the entire government. In fact, we announced on several occasions important, significant projects, hundreds of millions of dollars worth with the pharmaceutical industry, and we have further good news in the coming weeks, specifically in order to make sure that Canada is ready in the event of any future pandemic. And it's not only about vaccines or therapeutics. We've also seen that with personal protective equipment, my colleague Anita worked very hard over the first few months of the pandemic to make sure that, specifically about this issue, that Canada was well equipped, whether it be the federal government or the provinces, in fact. We did not have robust enough protections in place. We will make sure that a national government never finds itself in this situation again, and the Prime Minister and the Minister of Health have also indicated that when the pandemic is over, we will, of course, take the time to review what went well, what could have gone better, and give any future Canadian government all the necessary answers to protect Canadians. So Mr. O'Toole is arriving, in fact, to the same conclusion our government arrived at months and months ago. In other words, we have an obligation to make sure that we will be much more well prepared if ever we end up in the same situation. Anita may have something to add, or someone else? Yes, thank you very much. Dominic. Of course, when the pandemic started, Canada had no bioproduction capacity in-house to produce vaccines. The underinvestment in the vaccine capacity, production capacity, started decades ago in the previous century. We immediately understood we needed to invest, as Dominic said, in our domestic production. We also realized we needed to increase our facilities, the number of facilities, which we've done. The government has already aggressively invested in new biomanufacturing capacity. In fact, we have taken serious measures on this front even before the pandemic, and in our first term, we reestablish our capacity to invest in sciences, life sciences. We have constantly been increasing our investments in a targeted way since the beginning of the pandemic. We're talking about major investments in production capacity, such as Medicago and the National Research Council. And this is why the 2021 budget plans for $2.2 billion over 7 years to ensure the growth in a national sector. And these are areas, the life cycles area, where we're talking about many, many good jobs for the middle class. The Conservatives have voted against this investment. These investments will help create a talent pool and a research system for Canada. These investments will support the growth in the life sciences sector industries.
But in addition to all of these commitments to domestic manufacturing, at the same time, we are pulling in record numbers of vaccines, such that Canada is atop of the world in the administration of first doses. We've delivered 44 million vaccines to provinces and territories, 36 million of which have been administered. So our strategy is twofold: to build up domestic biomanufacturing on the one hand, and to bring in deliveries of vaccines for Canadians in record numbers. And we will continue to operate on these two tracks so that Canadians are well served, so that Canadian jobs are well served, and so that Canadian sciences are well served. Thank you.
Thank you, Minister Nant. Operator, next question. Opératrice, prochaine question.
Thank you. Merci. The next question is from, la prochaine question est de Sarah Turnbull, CBC News. Please go ahead. À vous la parole.
Hi there. Thanks for taking our questions. This one is for Dr. Tam. There's increasing speculation that a federal election could be called this summer or fall. Has the Prime Minister consulted you on how to campaign safely? And do you think Canada is in a safe enough place with COVID-19 to have a national campaign?
No, I have not been consulted on this matter. But we do have already published guidance on the type of public health measures that should be observed. And of course, the Chief Electoral Officer will take some of the those considerations in mind as they go about operationalizing any kind of election. So that kind of dialogue has been taking place throughout, the pandemic itself, really just to make sure people understand the guidance. And but in the end, of course, you also have to take into account what's happening locally at the time. So even now, as I said, Manitoba might be a bit different from Ontario, and maybe even within Ontario, there's different epidemiology. So local public health has to engage with the teams from the Chief Electoral Officer and Elections Canada. I think that's where the engagement occurs.
Okay, thank you. And I think for Dr. Tam as well, the new border changes are set to come into place on July 5th in just a few days. Is there any more information you can provide on sort of the privacy component, or how are you going to ensure there's the security of travelers' vaccination documentation on the ArriveCan app? Has there been any consultation with the Privacy Commissioner on this? Are you concerned about the privacy element? That kind of thing.
Yes, thank you for that question. And if needed, some follow-up can be done with the teams that actually work on ArriveCan. But as with any of these key initiatives, the proper consultations have been done. So that does involve the collection of information with the ArriveCan, including vaccination. And I think is essentially mandatory to use ArriveCan, but obviously whether you upload any vaccination information is also up to the individual as well. And so I think there's checks and balances in all of that process. But yes, I could certainly refer you to colleagues who actually work on the app. But based on what I know, these consultations were done. And I'm not sure if Minister LeBlanc actually has any more information on that front.
Thank you, Dr. Tam. And obviously, our colleagues at the Canadian Border Security Agency take the privacy concerns of Canadians very seriously. One of the things that our government wants to do in terms of developing, in partnership with the provinces and territories, the appropriate proof of vaccination credential for international travel is precisely to ensure the security and privacy of the personal health information of Canadians. We obviously have confidence in the ArriveCan app to date, but it is but a transitional measure until we get to a longer-term international proof of vaccine credential, and the appropriate authorities, obviously working with provinces and territories as well that share these same concerns, will be in touch with the Privacy Commissioner and others to ensure, as we develop these options, that we're respecting the privacy rights of Canadians.
Thank you, Minister. Opératrice, prochaine question. Operator, next question.
Thank you. Merci. The next question is from, la prochaine question est de Mylène Crête, Le Devoir. Please go ahead. À vous la parole.
Bonjour.
Good day. I'd like to get back to the question asked by Mia Rapson regarding the mask mandate in light of the potential arrival of the Delta variant in Canada, or at least an increase in the number of those cases. Would it be possible do you think it's advisable to maintain this mask mandate in anticipation of this other wave or even during?
Excusez-moi. Merci pour la question.
Thank you for the question. This is Dr. New. I can start with an answer. We are closely following the situation, of course, in Canada and throughout the world, as well as with the experience of other countries, given these variants of concern, including the Delta variant. What we're noting is that clearly the Delta variant is more transmissible, and that can have more severe consequences if one does get infected with the virus. In Canada at this point, the number of cases that we have detected per day, and also given the healthcare system as it stands today, we're in a good position. But of course, this means we shouldn't do away with these public health measures right away. I think all provinces and territories, all of our counterparts and colleagues know what can happen once we loosen these rules in public health. We see the results of what happens in the provinces and territories. How can we put it? We're in a position where we can provide advice to people everywhere in Canada, and even at the federal level, so we can provide some advice, such as what can you do if you've gotten both doses of the vaccines? What can you do with your friends, your family? But given what's happening, and it's important to really reiterate the fact that we need to increase the vaccine coverage, because more Canadians protected against COVID-19 means more Canadians protected against this variant, and it's better for the country. But we're seeing what's happening in other countries. Clearly, if we continue to follow this situation epidemiologically in Canada, and I think let's say we were to start with a local region or a province or territory, if we were to note indicators of an increase, let's say there's an increase in Delta or any other variant, if we see these variants having more of an impact, then clearly public health authorities at the local level or provincial level can bring down these other public health measures, such as mandatory mask wearing under some circumstances. Thank you.
Ma deuxième question.
My second question. What can we expect in the fall for children under 12? Will they be vaccinated? Will they be allowed to be vaccinated? Will they be vectors of disease, potential transmission of this variant? And sir, thank you. This is Dr. New again. Thank you for your question. At this point, we do not have an approved vaccine for children under 12. This is something that clinical testing is trying to determine. They're ongoing. And so while we wait for submission to Health Canada, as is happening in other countries, as to what will happen in the fall, the question is again to say, okay, what's the epidemiological picture in the fall in general in a particular community? Clearly, children, how can we put it? Children can be infected with the virus and can also spread it to others. But generally, the effects on them are less than they would be on adults. So I don't think the concern is so much about the children, the effect on the children themselves, but on those who surround them. Now, that is why when we look at the situation with the admissible Canadians who are eligible for the vaccine, they really need to get vaccinated. I really would love to have 100% coverage for both doses. If every eligible Canadian is protected, that's less of an issue for children under 12. Not being these children are not eligible at this point for the vaccine, but we're continuing to follow the evidence and the results of clinical studies. Also, we're looking at any submission for vaccine approval.
Merci, Dr. Arnoux. Donc, opératrice, à vous pour la dernière.
Thank you, Dr. New. Operator.
Over to you for the last question.
Thank you. Merci. The last question is from La dernière question est de Brian Mullen, Global News. Please go ahead. À vous la parole.
Good afternoon. This question is for the doctors. The Royal Society released a report today estimating that 6,000 COVID-19 deaths for people aged 45 and older are unaccounted for in official statistics. That could mean about two-thirds of the death toll may have been missed. Wanted to get your reaction to that report.
Yes, maybe I will start. So I think this is an important report, and it also goes alongside some of the statistics Canada look at excess mortality. We do know that based on some of the ascertainment of cases and also deaths, that some of these could indeed have been missed or are delayed in reporting. So I think that some of these studies will shed further light on the actual impact of COVID-19. And so I think both this report and the Statistics Canada reports on excess mortality will give us a better picture. Which ought to say is that it's even more important than ever to keep up with the vaccinations. One thing that I was really struck by when the vaccines first rolled out, particularly in seniors, not just in long-term care, but then obviously in the community, was how incredibly effective the vaccines were, because we saw the numbers of cases, but also the serious outcomes decline very quickly in those populations. If you imagine this third wave without the vaccine, the mortality impact would have been much higher. You see the deaths didn't rise as fast as the cases. What we saw this time around was actually an increase in ICU admissions and hospitalizations. For the older, more high-risk populations, I think saw the impact of the vaccines. But those are important studies, because we need to use it for planning purposes, but also for, how do we enhance our data and reporting systems going forwards as well.
On that, how important is it to get better reporting on deaths in Canada, and what are some of the challenges with keeping records of elderly Canadians living in the community outside of long-term care homes?
Yes, I think the provinces and territories that are reporting the cases have really stepped up in this pandemic, and then we had to come back together and say, well, there's more data fields that we need to have put in. Some of the individual case reporting lags the death reporting, because that takes longer to add to the database, and sometimes they're incomplete. So that's one area I think that we need to improve on. Vital statistics, really does take quite a long time to come through. The official vital statistics and going to Statistics Canada, for example. So we do need the more real-time estimates, as well as, of course, the formalized reporting later on as well. But I do think that real-time mortality reporting, alongside the other indicators, are really quite critical to any future responses, both in the community and in the different outbreak settings as well.
It's Dr. New. The only additional point I would add is that I think you've raised a very important issue, the sort of the critical nature of accurate vital statistics, including deaths. And even before COVID, it's always been, I think, a bit of an issue and a challenge because how a death certificate is filled out, could be seen as a quote, a mundane task. But, especially if someone dies and has multiple conditions, how that I think, the physician fills out the death certificate with quote, what is the, C or main, cause of death, or what are the underlying contributing factors, how that's filled out, that's what gets recorded and get collected as our vital statistics. So I think it just underscores the importance, and I think it's just something that all of us who are involved in that process, I think appreciate now more than ever. And obviously it's something to keep in mind as we continue to strive to do better, from the ground up in terms of the initial collecting or filling out of those death certificates, the data, how it's then collected and rolled up at a provincial level, and then obviously going to Statistics Canada and the subsequent analysis for, as Dr. Tam said, planning purposes, evaluation purposes, etc. Thank you.
Yeah, and just to add that there is the Pan-Canadian Health Data Strategy, and I'm sure that we really appreciate the work of the External Advisory Group, but Dr. Vivek Goel has done some recent interviews on that, and that the fundamental objective of that strategy is to help us all improve at every level, and all the different data providers, how we can do better in the future.
Thank you.
Thank you, Dr. Tan and Dr. New. Merci. Donc voilà qui met fin à cette conférence de presse. That marks the end of the press conference. Merci. Thank you.
Merci. Thank you very much.
Au revoir.
Au revoir.